These are my best tips and tricks of when and how to introduce a Binky. I'm gonna rapid fire this because my baby just woke up, so here we go. The first thing is when. When is the best time to introduce a Binky? This is gonna differ per baby, but basically my lactation consultant suggested whenever breastfeeding was fully established. First time mom, so I took multiple classes before the baby came. They all kind of recommended a different time frame. Generally speaking, the sweet spot's gonna be between 3 and 4 weeks. Some people introduce it as early as the hospital ride home. That part's up to you. And then my biggest tip is to offer the Binky to your baby after they've been fully fed, they have a clean diaper, and they're happy. Don't offer it to them when they're upset and you're trying to soothe them right away. Like, they first have to learn like what the Binky is to then later on use it as a tool to help self-soothe. So what worked for me is having my baby fully fed, diaper changed, she's happy as a clam, and then I swaddled her. You want to swaddle because you want to make sure their arms are away, they don't have any other distractions. Started with a few different shapes just to introduce them to her and see if she had a preference. She's playing on her playmat, so if you hear her in the back, she's happy, she's supervised, she's good. And what I did is I took the pacifier and I would just kind of slowly place it around her lips, like kind of introduce it to her that way. And then I took the course Taking Care of Babies, and she actually recommends placing it on their tongue. What worked for me was actually placing it on her tongue and doing little circles with the pacifier. And I would repeat that process just for like 2 to 3 minutes in the introduction process. If your baby gags, that's okay. Just take it out, give them a second, go ahead and put it back in. Most Binkies have like a little area where you can stick your finger in. So this was the Binky we started with. We also used the Dr. Brown's, and that's what she prefers now. I would just rub it in little circles on her tongue. I would take it out. I would try the other pacifier. I would do that, take it out. And really, I just did this exact same thing 2 days in a row during a happy wake window. By the second day, she was a pro. I'm not a lactation consultant. I don't claim to be a pro at this. These were just the tips that worked for me. Also recommend asking your hospital or for your insurance if lactation consultant is covered, because then you can ask and bring them in and have them help you as well. Okay, hope that helped.